Flu information for parents. What is influenza or flu? The flu is a respiratory disease caused by a virus that attacks the nose, throat, and lungs. Illness is usually mild or moderate, not requiring hospitalization. However, at times, the flu can be severe, even leading to death. It is not the same as the stomach flu. What are the symptoms? Flu symptoms include fever, dry cough, sore throat, headache, extreme tiredness, and body aches. These symptoms usually happen suddenly and might be severe enough to stop your daily activities. Should my child get a flu vaccination? Yes. Everyone 6 months of age and older should get flu vaccination every year. Getting a flu vaccine helps protect your child from getting the flu and helps prevent them from passing it to people who can get very sick from the flu, like babies, elderly people, and people who have chronic diseases. Are children at high risk for complications from the flu? Sometimes healthy people, including children, can have serious complications or die from the flu. Children at risk for serious complications include children aged 6 months to 5 years, but especially those under 2. Children and teens 5 to 18 years old with heart disease, asthma, or other pulmonary disease, metabolic disease, including diabetes, immune deficiency, blood disorders, long-term aspirin therapy, and teens who are pregnant during flu season. Should my child get 1 or 2 doses of the flu vaccine? It depends on your child's age and whether they got the flu vaccine in the past. If your child is 6 months to 8 years old, he or she may need 2 doses, at least 4 weeks apart. Ask your doctor or clinic. When should my family get vaccinated? For best protection, the flu vaccine is usually given in early fall, before flu season starts. But you can get it any time during flu season, which is typically October through April. How is the flu different from a cold? Colds are generally less serious than the flu. With a cold, you may have a runny or stuffy nose, while the flu causes body aches, fever, and extreme tiredness. A cold won't usually keep kids from their normal activities, but kids with the flu will often feel too sick to play. Unlike colds, flu can cause serious health problems like pneumonia, bacterial infections, and hospitalization. What type of flu vaccine should my child get? There are now several types of flu vaccine available. Your healthcare provider will know what type of vaccine is best for your child. The most important thing is to get them vaccinated. Flu vaccine and allergies. Children with an egg allergy can safely get a flu vaccine. Life-threatening allergic reactions to the flu vaccine are very rare. Talk to your healthcare provider if your child had a life-threatening reaction to a flu vaccine. What if my child has the flu? Stay home if you or your child is sick. Rest and drink lots of fluids. Children may need fever-reducing medications to keep their fever under control. Follow your doctor's instructions. Antibiotics will not help a person recover from the flu. The flu is caused by a virus, not by bacteria. Take your child to the doctor or the emergency room if he or she experiences breathing rapidly or with difficulty, has bluish skin color, does not drink enough and becomes dehydrated, does not wake up or interact with others, is so irritable that he or she doesn't want to be held, gets better only to become sick again, with fever and a more severe cough. If you are concerned that something does not seem right with your child, call your doctor or clinic. What can I do to protect myself and others? Get vaccinated. Avoid being around others who are sick. Cover your nose and mouth with a tissue when you cough or sneeze, or cough or sneeze into your sleeve. Wash your hands often with soap and water or an alcohol-based hand sanitizer. Protect infants by not exposing them to large crowds or sick family members when the flu is in your community. Do not share drinking cups and straws. Frequently clean commonly touched surfaces like doorknobs, refrigerator handles, phones, and water faucets. What about antiviral medicines? Antiviral medications can offer some protection if you have been exposed to the flu. Contact your healthcare provider right away if your child gets sick with the flu and is at high risk for complications from the flu.